The United States is accustomed to leading the charts in many areas, but becoming number one on this one chart was doubtless a very heavy reality. I am talking, of course, about COVID-19, for which America has been unfortunately paying an incredible toll. The United States is now leading the number of confirmed cases of COVID-19 with over 1,100,000 cases. It is also now the country with the highest number of deaths. Just in the state of New York, there is over 300,000 cases. What went down, and how did it impact the average citizen? I talked to Shivam Parikh, a graduating senior in UC Berkeley and an incoming software engineer in Salesforce. Shivam is a triple major in computer science, data science, and environmental economics and policy.
The gravity of the situation, I think, started to change probably in February, mostly because the first couple cases that happened, the information was pretty unclear, and the location and the scale of the situation was not particularly threatening at the time. And so it felt like, oh, it was only an offhanded case here or there, something that happened because of like one-off occurrences. But in actuality, the way that the virus spreads and the scale at which it spreads exponentially meant that that should have been a much bigger problem at the time than we made it out to be.
Shivam has been home ever since March 15th, taking on the challenges this pandemic has been inducing. One major one, education.
For the educational aspect, it's tough to get the same level and quality of education online as it was when we were in school. It's difficult to find the focus and just mental fortitude to drill down on academic work. A lot of college students find it easy to balance school with their social activities and the social network and I guess like friend and acquaintance safety net that they have, that kind of fallback where they have some societal backing around them. And, you know, some of us are very fortunate to have our families take that place when we come home, but not everyone is in that position. It's important to understand that not everyone has the same opportunities to succeed in this situation, and that the learning is most definitely compromised because the level of in-person interaction that a lot of students thrive on is not able to be offered anymore. As a teacher myself, as a teaching assistant for an upper division computer science class, I've had to move all of my office hours online, and the kind of interaction with students, being able to review their code, find bugs, help them solve their problems, and draw on whiteboards, all of these things have kind of gone away. And the ability to interact in person obviously is not as large of a loss in our field as it is in others, but it definitely does take away from the learning experience, in my opinion.
And what about the economy and the job market?
The job market is not looking steady. 22 million people or more have filed for unemployment in the United States, which means that hiring is definitely at a freeze, and that people are not going to be able to have the same wages or the same labor prospects as they once were. It's known economic fact that when students graduate during times of recession, their overall income levels throughout the remainder of their employment tends to be lower. And so knowing that this is kind of a permanent situation or a permanent impact is not great to think about from an employment standpoint. But then the comfort lies in the fact that we've always come back from situations like this, and I think with the appropriate federal response and state response, we should be able to come back from this issue as well.
Next, we jumped into talking about the trajectory of the virus in the States. Yes, the country has the highest number of cases, but does that keep in mind its significant population size when compared to other countries?
The population is significantly higher in the United States. There's about 330 million people, and the per capita infection rate and death rate is probably not as high as some of the other countries that were seen to be the hardest hit or in that level of a curve.
As it turns out, Shivam is right. When you look at number of cases per million inhabitants, data from Johns Hopkins University position US in the 6th place after 5 European countries. Shivam thinks the bigger issue lies in the fact that the US was given the time to prepare, but failed to act in a fast and comprehensive manner. But what did they do wrong and what did they do right? Shivam says both answers lie in the Constitution.
State governments have taken larger control and reinstituted one of the core tenets of the American democracy, which is that there is a strict dichotomy between states' rights and federal rights for the government bodies. And so states have taken independent control. The only issue being now that interstate travel and interstate commerce still exists and is controlled at a federal level. So if states are taking their own decisions and making their own choices, each state also deserves to be protected from other states. But another very clear issue with that is that these are not individual states, these are the United States, and having that separation doesn't bode well for the future of the union.
News organizations have the responsibility to report on the truth, which comes out of the global information sphere. Shivam questions if every organization took on this responsibility fully during this pandemic.
I think that alone is grounds for changes in the American sphere of information, of news, of journalism and reporting, that there is a responsibility to deliver safe, truthful, honest, and unbiased information to the public. The fact that that wasn't the case has definitely resulted in an increase in coronavirus cases. People are willing to risk delivering untrue information and unsafe information in exchange for a more rapid response to their content. If all of the media had convened on a single message that was known to be truthful and honest, that we are in a predicament that we don't know how to solve and we don't have the resources to solve, then taking that action earlier would have led many Americans to also converge upon the same single fact that staying home is the solution that we have right now.
What about where the responsibility lies from this day on? Is it the people or is it the governing bodies? Shivam thinks change should come from policy. He thinks that if the government had imposed restrictions early on, people would have followed.
The impacts that could have been felt by addressing this at a federal scale or at an like a much larger scale much quicker than they did would have been felt and seen today. We wouldn't see the same number of deaths and the same number of cases if we had taken comprehensive action early on.
What makes America's case unique? Number one is industry.
It's a hub for so many industries, and that alone causes a much higher level of inflow and outflow from both sides on the Atlantic and Pacific sides of the economy. That kind of level of interaction on a global scale has gone unchecked for far too long. And I think we're starting to realize that maybe the level of travel that we have puts us at risk of spreading viruses and pathogens in ways that we had not previously considered.
The second unique aspect of America is the political climate.
The political divide that exists in the country right now is much more stark than that of many other countries. As a whole, there's almost like a 50-50 split is what it feels like and is what it felt like during the last federal election that we had.
And finally, a lack of medical coverage and insurance infrastructure for the average American. Shivam thinks that a majority of other countries that took a hard hit from this pandemic have comprehensive healthcare services provided by the government either permanently or for the time of this crisis. But in America, Shivam says people are afraid to seek medical care.
Afraid of the bills, afraid of the repercussions, afraid of what would happen to their jobs. The fact that there was no social safety net to say that if you are sick, we will take care of you, that really plays a role in how much the virus can spread. Because if people are willing to get tested, if people are willing to seek out medical care in advance, if they are willing to seek out preventative measures instead of reactionary measures, you can stop the virus in its tracks.
Shivam thinks the key to success can come from data. In fact, this map he created shows the spread of cases in the US in a logarithmic scale over time.
It feels odd because especially living in the center of technology, we're always surrounded by data. There's never been a lack of data. Anytime that someone asks for data to build a new product, the data is readily available, or there are many ways for us to be able to collect that data almost immediately from a timescale perspective. And in this situation, when it was time sensitive, it didn't actually happen and we didn't have that data to act upon.
A major player in all of this is the Trump administration. Does the fact that America is facing this challenge under this administration create additional issue areas?
The sitting president has a certain perspective on government and a certain perspective on spending that has not been seen in previous administrations, at least within my lifespan. Spending federal American money in response to an American crisis has never been seen as a bad idea before in any administration that I've lived through. During the 2008 economic crisis, the government was not opposed to spending billions, if not trillions of dollars, trying to bail out corporations that needed money to survive, to keep Americans employed, to keep the economy spinning and running. We're not really seeing that today. We saw a check written by the government for $2 trillion. And somehow out of all of that, the American people, and not even all of the American people, but a small number of American people found themselves with a one-time check for $1,200. People are anxious to get out. People are anxious to go back to work because people have bills that need to be paid. That's totally understandable from a financial standpoint, but from a federal standpoint, the citizens shouldn't have to be worried about their next paycheck. They should be worried about whether or not they're taking the right precautions to ensure their survival. I mean, that's the overall job of the federal government, is to ensure the survival, the well-being, and the productivity and care of the citizens that they represent.
But Shivam thinks that instead of seeing a representation of citizen interests, we see a representation of commercial interests.
We're seeing money being sent directly to corporations who will continue to lay individuals off instead of taking the money and reinvesting it into their workforce. If the economic implications were that if we don't bail this corporation out, they will lay too many people off, that money may have been better spent by simply giving it to the workers that were laid off. The question is begging to be answered is, why is the government not representing the interests of the people? Why is it representing the interests of the donors and the corporations?